Every year, millions of people around the world are diagnosed with cancer. But what's truly heartbreaking is that many of these cases could have been caught earlier, if only the signs hadn't been ignored. Today, I want to share with you the top 10 cancer symptoms people ignore until it's too late. Because sometimes it's the smallest whisper from your body that's actually a cry for help. To begin with, let's talk about unexplained weight loss. Have you suddenly dropped 10, 15, or even 20 pounds without changing your diet or exercise? Sure, some might call it a blessing at first, but sudden weight loss can be one of the earliest signs of cancers like pancreatic, stomach, esophageal, or lung cancer. Why? Because cancer cells consume a lot of energy and can change how your body processes nutrients. Studies show that about 40% of people with cancer experience unexplained weight loss at diagnosis. Tumors can release cytokines, which increase metabolism and break down muscle and fat. This isn't healthy weight loss. It's rapid, uncontrolled, and often comes with loss of appetite or digestive symptoms. Next, there's persistent fatigue. We all feel tired sometimes, busy lives, poor sleep, but cancer fatigue is different. It's a deep, bone-tired exhaustion that doesn't get better with rest. If you're finding it hard to get through the day, even after a good night's sleep, it's worth mentioning to your doctor. Cancer-related fatigue is often caused by anemia, common in leukemia, colon, or stomach cancers, inflammatory chemicals released by tumors, or the body's effort to fight the disease. Unlike regular tiredness, this fatigue can affect your ability to work, exercise, or carry out basic daily tasks, and it lingers despite rest. Another concerning sign is unexplained bleeding, blood in your stool, urine, or from coughing. Many brush it off, blaming hemorrhoids or minor infections. But here's the truth. Unexplained bleeding can be an early sign of colon, bladder, kidney, or lung cancers. Never assume, always check. Colon cancer can cause dark, tarry stools or bright red blood. Bladder or kidney cancers may cause pink or reddish urine, sometimes without pain. Lung cancers can lead to small amounts of blood and phlegm. Research shows early detection of bleeding-related cancers significantly improves survival, yet many people delay care for months. Moving on, difficulty swallowing is something to take seriously. A woman once shared with me that she started avoiding breads and meats because swallowing became uncomfortable. By the time she saw a doctor, she was diagnosed with esophageal cancer. If you're having ongoing difficulty swallowing or feel like food is getting stuck, please don't ignore it. Esophageal or throat cancers can narrow the food passage, leading to progressive swallowing issues. People may switch to soft foods without realizing the underlying cause. Associated symptoms can include pain when swallowing, unintended weight loss, or even frequent heartburn. The sooner this is evaluated, the better the treatment options. In addition, a persistent cough or hoarseness can be a red flag. A cough that lingers beyond 2 to 3 weeks, or a hoarse voice that just won't go away, could signal lung, throat, or thyroid cancer. Especially if you're a smoker or have been exposed to secondhand smoke, this is one symptom you cannot afford to ignore. Studies show that a chronic cough in smokers has about a 10% chance of being linked to lung cancer. Hoarseness can be caused by vocal cord paralysis from thyroid tumors or laryngeal cancer. If accompanied by shortness of breath, chest pain, or coughing up blood, prompt evaluation is critical. Equally important are changes in skin or moles. Do you have a mole that's changing in size, shape, or color? Or maybe a new spot that looks odd? Skin cancer, especially melanoma, can start as a harmless-looking mole. The rule of thumb: look for ABCDE asymmetry, border irregularity, color changes, diameter over 6 millimeters, and evolving over time. Melanoma accounts for only about 1% of skin cancers, but causes the vast majority of skin cancer deaths. Early-stage melanomas are nearly always curable with surgical removal, but once they spread, survival drops dramatically. Other skin signs include non-healing sores, pearly bumps, or scaly red patches, all worth checking. Let's not forget persistent bloating or abdominal pain. We often blame bloating on diet or stress, but persistent bloating, especially in women, can be an early sign of ovarian cancer. One woman I spoke to thought it was just her age or hormones. By the time she was diagnosed, the cancer had spread. So if you're experiencing persistent bloating, pelvic pain, or feeling full quickly, Get it checked. Research from the UK shows that 70% of women with ovarian cancer report bloating as a symptom, often before other signs appear. Unlike menstrual bloating, this type is constant, often with urinary urgency, back pain, or changes in appetite. Early detection is key, as ovarian cancer is often diagnosed at advanced stages. Furthermore, changes in bowel or bladder habits should raise concern. Sudden constipation, diarrhea, narrow stools, or feeling like your bladder isn't emptying. All of these can point to cancers of the colon, bladder, or prostate. If your body's routine has changed and it's lasting more than a few weeks, it's time to consult your doctor. Thin or pencil-like stools can signal a blockage from a colon tumor. Blood in urine or urinary frequency may point toward bladder or prostate issues. While infections and diet changes are common causes, cancer needs to be ruled out when these symptoms persist. We should also highlight unexplained pain. Pain that lingers for weeks without a clear cause can sometimes signal cancer, especially if it's in the bones, back, or head. We often mask pain with painkillers or tell ourselves we're just getting older. But pain that persists or worsens deserves medical attention. Bone pain may come from metastases, cancer spread, especially from breast, prostate, or lung cancers. Back pain, when combined with weight loss or neurological symptoms, can sometimes point to pancreatic or spinal tumors. Headaches, especially with visual changes or nausea, may need brain imaging. Persistent pain should never be ignored. Lastly, night sweats or fevers can be your body's warning sign. We all get fevers with infections. But if you're experiencing frequent night sweats, chills, or low-grade fevers without an obvious infection, this can be a sign of blood cancers like leukemia or lymphoma. Your body is trying to fight something. Don't ignore the warning signs. Blood cancers disrupt normal immune function, leading to cytokine release and temperature changes. Night sweats often soak through clothes and sheets, and low-grade fevers may come and go for weeks. Unintentional weight loss and swollen lymph nodes are other red flags. Blood tests can help uncover these cancers early. Here's the takeaway. Our bodies are incredibly wise. They whisper to us long before they scream. The earlier you catch cancer, the better the chances of successful treatment. So please, listen to your body. If you found this video helpful, share it with someone you care about. You just might help save a life. Leave a heart in the comments if you believe in being proactive about your health. And remember to subscribe for more simple, life-saving health tips.